Listen, if you have a nursing facility where you all take long-term care patients, Medicaid pending, private pay, what have you, a lot of times you're going to end up getting patients from other facilities where the resident has gone to have like a short-term type of rehab stay, and they've used their insurance, so and that particular facility doesn't do long-term care, or maybe they've been in assisted living or independent living and they can no longer age in place because that type of facility can no longer meet their needs clinically because they are what they are. Independent means independent, and assisted means just that, assisted. So aging in place isn't an option at all of those places. So I had to tell you that to say a lot of those patients come from really cosmetically nice facilities, which is why initially either the patient and or family chose to go there, because upon, either they looked at the Google ads or whatever and the facility was a replicate of what was on there, or they toured and they really loved it and so they made a choice, and then now they can't stay and they need a long-term care facility, and honestly those are minimal nowadays. They're either full or they're not as, for the most part, they're not as cosmetically appealing as the rehab setting or the assisted living or independent setting that they're coming from. You cannot get upset as a facility owner or administrator or leader or what have you when those residents transition into your level of care at your facility and they're upset because cosmetically it's not as appealing as where they came from. Maybe it's not as clean as where they came from. Maybe it's extremely outdated to the point that maybe the furniture isn't even in one piece. I'm talking completely outdated. And maybe it is partially clean, but we all know if you take a partially clean house and you put a brand new couch in it, a lot of times you're not really looking at the overall state. It's partially clean, it's okay, it's not awful, and that couch just, you're just focused on the couch. So if you have one of those entities that needs some updating, get it updated. If it needs to be cleaned more, clean it more. If you want that clientele and you want to successfully keep them, you've got to do your part to do that. You can't get upset at your salesperson because the patient gets in house and they don't want to stay, or your admission person, or maybe the patient didn't get to see it and the family did, and they're like, you know what, we don't know what else to do, so we're gonna bring them here. Like, you got to do your part, folks. That's a big transition for them, and it doesn't necessarily have to be the same or equal to, but it at least needs to meet a certain level of expectations. Y'all have a good day.